Hi guys, my name is Josh Pedicaro. I'm an internal medicine doctor in Canada and currently finishing my ICU fellowship. I just wanted to take the opportunity to personally address some of the many questions that I've heard from family, from friends, rumors, conspiracies, etc. Around the coronavirus pandemic. Obviously, it's taking the world by storm and affecting everybody's lives in unimaginable ways. I think the first question about how serious this is and questions around conspiracies, is the media hyping this up? I can tell you I've personally seen numerous coronavirus patients in ICUs. This is not a joke. This is a big deal. This is not just immune compromised patients. This is not just the elderly. This is not just people with pre-existing medical conditions, unless you want to count being overweight or having a little bit of a high blood pressure as being a pre-existing condition. I've seen patients as young as in their 20s going on life support. I've seen middle-aged patients. I've seen elderly. This is a big deal. These patients are hanging in the balance between life or death. And not only is this a big deal for them, it's filling up ICUs, it's limiting resources for other patients that we routinely are always operating on just the cusp of full capacity. Now it's even more difficult to take care of those patients as well. The resources are being stretched in terms of medications, in terms of supplies, even resources. Any nurse, any respiratory therapist that has any symptoms has to be quarantined, and that's taking them away from the front lines as well. So this is stretching systems everywhere, not just in Canada, definitely in the US. I have my ear to the ground in New York as well. They're being stretched as well. I have friends in some cities in the US where the entire hospital has been turned into a coronavirus hospital and they're shipping patients out. I'm not sure where misinformation is coming from. I think some people may be thriving on this misinformation and getting a kick out of it, but it's nothing to be taken lightly of. The only solution we have here is following the recommendations of social isolating, physical distancing, and riding this out until we start seeing a flattening of the curve. And it's not clear how long this will take. I think my message would be, don't believe the hype, don't believe the news reports day to day about trends and thinking that things are getting better or thinking there's cures right around the corner. I think I've been getting a lot of questions about what treatments are out there that are proven and why aren't we doing this, why aren't we doing that. Obviously the media is latching onto any little glimmer of a story that they can. The bottom line is I've looked at many of these papers myself. The stories about the anti-malarial medications, chloroquine, hydroxychloroquine, they don't even meet any threshold to begin using in patients. There's multiple reasons for that. Number one, no evidence that they are clearly helpful in patients in making them get better. It's one thing to have a drug that works in the lab and in a dish full of cells. There's a ton of drugs that have passed that bar, but to actually make patients better, not the case. Hopefully there's a possibility it's being studied, but it's definitely not the case right now. The studies that are out there are tiny, like 60 patients with terrible methodology, the patients that they don't even account for as they get worse. They've taken them out of the study. You can't interpret the data like that. Number two, you could be actually harming these patients and you won't find out. And if we went and treated thousands of patients only to find out that we're actually killing them, would be a disaster. And there's also other indications that these drugs work for. And to sap the supply for indications that these drugs are already useful for would be definitely a travesty. In terms of other things like vaccines, that's going to be far away. That's months, if not a year or more, to get a vaccine that's tested, that can be distributed, and that actually is efficacious. I'd be very surprised to see anything sooner than that. Another question I've been getting a lot is about why are we seeing such a difference in cases and in the deaths between different countries. For example, in Italy, you're seeing almost 10% of patients dying. Well, over there, a quarter of their population is above 65, and also they don't have good access to testing. They're really limiting it to patients that are actually sick and in hospital. So you're only testing the sickest people, and you're getting a lot more people dying. Whereas in the US, the test has now become a lot more available, so you're testing a lot more people that are actually not as sick. The last question I would address would be around the use of masks and PPE. The bottom line is, if you are a healthy person with no symptoms, a surgical mask or a homemade mask may not be a terrible idea while you're out in public, but that's mostly just to protect other people, as if you're coughing, that you're not spraying it on them. An N95, there's no good reason that you're using this when you're out in public. You're sapping resources that we need in hospital. We're all desperately in need of these. And there's not going to be aerosols floating around when you're walking down the street. I can tell you, having personally had to go into rooms of patients with coronavirus, even with full PPE, there is that fear that's in your mind. You're doing the best you can for your patients, but you are always in the back of your mind thinking, in a week or two, am I going to get a fever and a cough? Am I going to become sick? Am I going to need life support? It's going to happen to some healthcare workers. It already is happening. We're still doing our part. We need you to save the PPE for us and those that are in the high risk, high exposure scenarios where the viral load from these patients is very high, floating around. Bottom line is we're going to get through this, and we're going to get through this together. We need to not panic, act rationally, act logically, protect yourself, protect your family, protect others. Follow the advice of the medical experts. Be very wary of any messaging you're getting from whether it's politicians with political agendas, the media that's trying to hype things up. It's obviously very difficult in the age of excess information to tell what's accurate and what's not. So hopefully this information was somewhat helpful. I'm happy if you want to reach out to me for any questions. I can do another one of these for sure if in the future.